Hello everyone. In this video, we will know about what are ICD conventions. ICD-10 CM, International Classification of Disease, 10th revision, clinical modification. So it is used to code signs and symptoms, reason for the visit, diseases and diagnosis. For example, fever, hypertension, fractures. It is published by WHO, World Health Organization, and every year it will be updated on October 1st. Conventions. It tells you how to read, understand, and apply ICD-10 CM codes correctly. So, ICD book has two parts, alphabetical index and tabular list. So, you have to first search the disease in alphabetical index and then confirm in the tabular list. For example, if you search diabetes, you have to search diabetes word in the index according to the alphabetical order. After finding the code beside the diabetes, you will have to verify the code in the tabular list. Next, it is very important to note that body parts are and organs never be kept as a main term. Instead, you have to code the condition which is related and there should be a main term. For example, a patient presents with knee fracture. So you have to code fracture as a ICD code. You have to search fracture in the alphabetical index, not knee, as it is a body part. ICD code format and structure. So generally ICD codes have 3 to 7 characters. Minimum characters will be 3 and maximum characters will be 7. For example, S72.020A. So the first 3 letters indicates category and rest of the letters indicate subcategory. And the first character, it indicates alphabetic, that is chapter name of ICD. Second character, it will be numeric, and 3 to 7 characters, it can be alphabet or numeric. Fourth character refers to etiology or cause. Fifth character refers to location. Sixth character refers to laterality, right or left. For example, right knee, right leg, right eye, right ear. And seventh character refers to extension. Use of codes for reporting. Always use the highest level of specificity. For example, document states acute appendicitis with perforation. So what generally people do, they find acute appendicitis in the alphabetical list and they code as K35. That is, it is general appendicitis. So what you have to do is under the acute appendicitis, there will be the list of symptoms. So they will be given with a list of symptoms. You have to code, you have to search acute appendicitis with perforation. So you will be finding K35.2, that is appendicitis with perforation. Next, placeholder. So placeholder, it is indicated as X. So X, it fills the empty spaces so the code reaches required length, that is 7 characters. For example, T36.0x10. So here the fifth character is a placeholder. So placeholder, it is used to ensure the code is valid and complete. Seventh character. So seventh character, you will be seeing the chapters of 19 injury and poisoning, that is fracture codes, and 18th signs and symptoms, and in musculoskeletal system, that is 13th chapter. So these chapter codes require complete 7 character. So some code requires a 7th character to indicate the type of encounter. Encounter means the reason for the admission. So it will be initial, first time visit to the hospital, subsequent, that is visit after the completion of treatment, and sequela it means late effect of the treatment. For example, S52.521A is for initial visit. So here A is the 7th character. When the patient presented for the initial visit, we have to code 7th character as A, while is 52.521D. It is for follow-up visit. So here D is 7th character. So if the patient presented to the hospital for the follow-up visit, we have to code D as 7th character. Sixth, abbreviation of NEC, not elsewhere classifiable. So NEC, it is used when the provider gives a specific condition but there is no code exist in the coding set. For example, the provider giving the type of pancreatic disease, it means the specific type of pancreatic disorder may be coded other specified pancreatic disorder. It means there is no code exist for the type of pancreatic disorder in the ICD book. Then we have to code other specified, that is NEC pancreatic disorder we have to code. Abbreviation NOS, it is not otherwise specified. So it is used when the provider does not give the enough details to assign a specific code. For example, provider, it means doctor or physician, documents, states otitis media. So otitis media, it is a ear condition. So it did not state whether it is a chronic or acute, or it is in the left ear or right ear, or it is in the 2 ears. So then we have to code otitis media unspecified, that is H66.9, because it did not give enough details in the document. So we have to code NOS otitis media or unspecified. Next, brackets. Brackets, it is used for the synonyms or explanation. For example, hypertension, high blood pressure. So in some of the ICD books, near the condition, beside the condition, you can see the brackets. They will say the synonyms, means hypertension. What is the meaning of hypertension? That is high blood pressure. Another example, MI. MI is a myocardial infarction. So another, beside the MI, you will be seeing heart attack as its synonym. Parenthesis. Parenthesis, it contains extra words that do not affect the code assignment. For example, if the document states benign hypertension or primary hypertension. So you can have a look here in the picture, essential, or in the brackets you can see primary hypertension. So if the document states primary hypertension, you have to code the code beside the primary hypertension. Even it is present as essential hypertension, this parenthesis word will not affect the code or the assignment. You can see here benign hypertension, arterial hypertension, essential, malignant hypertension, or primary hypertension or systemic hypertension. If the document states like that, you have to code the code beside the essential hypertension. So these parentheses will not affect the code or the assignment of the documentation. Colon. A colon indicates that more information is needed to complete the code description. For example, otitis media. So if you see the colon beside the otitis media, it means it requires you to specify whether it is chronic or acute. So if the colon is present beside any condition, it means the condition is incomplete. So it requires more information to complete the code description. That's it. And next one, include notes. So include notes, it indicates the condition that are part of the code. For example, hypertension, it includes the benign hypertension. For example, you can see in this ICD book, part of the ICD book. So essential hypertension, it includes high blood pressure, hypertension, arterial, benign, essential, malignant, primary, or systematic. If the document states high blood pressure, so you don't have to search for the other code. You have to code essential hypertension. If the document states arterial hypertension, if the document states arterial hypertension, then we have to code essential hypertension. No need to code of other code, no need to search for the other code, as it is includes, it means high blood pressure, it is the part of essential hypertension. That's it. Default code. Default code, it is used when no additional details provided in the documentation. For example, if your physician documented as diphtheria in the documentation and no additional details, means without details you have just mentioned diphtheria condition, then the default codes are used. For example, after the diphtheria condition you have to search in the ICD book, ICD alphabetical index book. You will search in the ICD book diphtheria. So the code which is present beside the condition, it is considered as default code. Another example, you see if you search the diphthalamus condition in the ICD book, you will see the code beside the diphthalamus condition, that is Q55.69. So this will be the default code of the condition. Next, code also. Code also, this instruction tells you to code another condition if it exists. For example, it means you need to add another code for a second condition that is also present. So there will be two conditions present in the documentation. For example, I'll say the example. If the document states pulmonary hypertension and sleep apnea. So first you have to code pulmonary hypertension and next you have to code sleep apnea. You can see here in the description in the ICD book, pulmonary hypertension is given. So first you have to code pulmonary hypertension. Next, below the description, below the code, you can see here code also guideline. So you have, first of all, if you after finding the condition, you have to read all the description in the tabular list. So you can see here code also guideline. It is associated with lung disease, as the document states pulmonary hypertension and sleep apnea. So first you have to code pulmonary hypertension and second we have to code sleep apnea. It is present in the pulmonary, under the pulmonary hypertension with code also guideline. So you have to code two codes according to the code also guideline. Use additional code. Use additional code, it means you need to add another code for more information. For example, it means the initial code alone is not sufficient and you need to add another code to provide complete details about the patient's condition. For example, patient present with chronic ischemic heart disease and he has a history of tobacco dependence. So he has presented with chronic ischemic heart disease and he has the history of tobacco dependence, but not in his present time. But even though you have to code along with the main condition. For example, you can see here chronic ischemic heart disease. As he presented with chronic ischemic heart disease, you can also see here use additional code guideline. So you can see under chronic ischemic heart disease, use additional code to identify. So if any other condition also present, you have to code along with the main condition. As the patient has history of tobacco dependence, you have to code Z87.891 along with the chronic ischemic heart disease. C and C also guideline or convention. So these are cross references to help you to find the correct code. For example, patient presented with meningitis and another patient presented with meningioma. So if you search the meninges in the alphabetical index of the ICD, you will see C condition and meningioma in the alphabetical index. They will give, look at this, C also neoplasm, meninges and benign. So after searching meningioma, they will instruct you to check neoplasm under the meninges and benign condition. This is the guideline of C and C also. You can look at the another example here you have given the patient present with fibrous condition, you will search the meningioma fibrous. You will search the meningioma fibrous in the ICD book, but they will also say to check neoplasm, meninges, and benign according to the C also condition. So after, if you see the C neoplasm, meninges and benign, you have to search neoplasm condition under the meninges and benign. Code first, it means the underlying condition should be coded first before the related condition. It means you must code main disease first and then related condition. For example, patient presented with diabetes mellitus due to underlying condition. It is cystic fibrosis or malignant neoplasm. You can see here diabetes due to underlying condition. If the patient present with cystic fibrosis, diabetes mellitus due to cystic fibrosis. So the cystic fibrosis is the main reason for the diabetes. So first you have to code cystic fibrosis E88, E84, and next you have to code diabetes mellitus due to underlying condition. I'll give another example. If the patient presents with diabetes mellitus due to Cushing syndrome, so you have to code Cushing syndrome, that is E24, and after that you have to code diabetes mellitus due to underlying condition. This is the code first guideline. Combination codes, that is with guideline. So with, it represents multiple conditions in a single code. For example, patient presented with diabetes mellitus with kidney complications. So then we have to code with guideline. You can see example in the pick type 1 diabetes mellitus with kidney complication. So you have to link two conditions together. For example, patient presented with diabetes and kidney complication. So these conditions you have to link with the guideline. So you have to code two conditions together. Type 1 diabetes mellitus with diabetic nephropathy. It means the kidney complication, right? Nephropathy means disease of the kidney. Then you have to code diabetic nephropathy. Got it? Next, signs and symptoms. So if, for example, signs and symptoms, we should not assign signs and symptoms if your confirmed diagnosis is available. Example, if a patient present with fever and diagnosed as malaria. So a patient presented in the hospital for fever, and after all the tests, he diagnosed as malaria patient. Then we have to put malaria as the diagnosis. You have to search the term malaria and find the code and assign the code. This is the condition. If the diagnosis is present, if the diagnosis is done, you have to code this. If diagnosis is not confirmed after the completion of test or treatment, you have to code as the fever, that is symptom. So if the diagnosis is not confirmed yet, then you have to code the symptoms. If the diagnosis is present, you should not code the symptoms, only diagnosis should be coded. If the diagnosis is not present, then you have to code symptoms. Combination codes due to guideline. So due to guideline, it means the cause, reason for the condition or effect condition between two conditions. It means one condition is caused by the another condition. For example, patient presented with diabetes mellitus. It is caused due to underlying condition along with the foot ulcer. It means with the guideline it will be used. We have to mainly focus on due to guideline. So patient presented with diabetes mellitus, but the reason is underlying condition. So you have to code. You can see here example, diabetes mellitus due to underlying condition foot ulcer, that is E08.621. Thank you so much for watching my video. If you want, which topic would you like me to cover next? Comment your choice below.